Hello, hello. Welcome to today's live. If you I have a line on my head because I was just at an acupuncture appointment. I Let me know where you're watching from. Leave a comment. Uh, Today we're going to be talking about contaminated eye drops and just being careful with them. Why is this near and dear to my heart? Because I have Sjogren's, so that's an autoimmune condition. It attacks my exocrine gland, so I suffer from dry eyes, dry mouth, dry everything. If you, my body is like a dried up raisin. Like I feel like all the volume from all the water from my body has been like dried out. Of course, I'm being facetious. Obviously, in order to be alive, I have to have some water in my body, but so that's what we're going to be talking about today. Let me bring that up here. I did recently upgrade to the like pro version of StreamYard. So hopefully you can see the articles better because it's in 1080 and before it was like in 720. And I do think I can see the articles better here. Um, Also, just a little bit of like housekeeping. Part of ADHD is like being bad with time management. And like I literally just got home from my acupuncture appointment. I'm bad with time management when it comes to my personal life. So I feel like I have no time to run errands on my days off. So most likely, instead of going live every week, I'm going every Friday. I'm going to either decide like every first Friday of the month and third Friday of the month, or every like second and fourth Friday, because it's just not sustainable for me to do every single Friday. Um, so please be careful if you are purchasing eye drops. Drops that are contaminated. I had seen another article, like even CVS Health brands, those are contaminated. A lot of the generic ones are contaminated. So advocates are cheering FDA's recent actions around problematic over-the-counter eye drop products, arguing the issue has been neglected far too long. So the FDA has had to step in here for over the counter drops because people are dying, people are losing eyes. Historically, nobody ever cared about over the counter drugs. Rebecca Petrus, president of the Washington state based Dry Eye Foundation, told MedPage. Petrus added that FDA's recent actions have given advocates hope that the industry will be more strictly scrutinized going forward. The good part here is we know the FDA is working really hard on eye drops now. So, FDA scrutiny of eye products increased in February of 2023 when the agency and the CDC identified an outbreak of Pseudomonas linked to EzraCare artificial tears and a related product made by India based Global Pharma. In total, the outbreak affected 81 people across 18 states, including 14 who suffered vision loss, 4 who required removal of an eye, and 4 deaths. This is insane, because some eye drops were contaminated. The tragedy with EzraCare, so this is the brand that you need to avoid. And if you look at your eye drops on the back, it'll say which like pharmaceutical company made it. The tragedy with EzraCare artificial tears made the FDA aware of the potential for serious, even fatal complications from poorly manufactured over-the-counter eye drops. The FDA has been ramping up their factory inspections and enforcement actions as a result. Our first priority is to protect consumers and alert them as soon as possible when we learn of quality problems with FDA related products. And the recent recalls are one part of the FDA's continuous efforts to ensure the quality of eye products and is not a response to any specific event. Petrus said it's important that the agency has become more serious about cracking down on manufacturing and selling of potentially dangerous eye care products. Following the early February warning and recall of EzraCare and Delsum eye drops, so this is another brand to avoid, 2 more companies recalled eye care products due to sterility concerns in March. Apotex and Pharmatica. Over the summer, FDA warned about products from Dr. Burns and Light Eyes due to bacterial or fungal contamination. There, I saw a Facebook or like a TikTok post going around about people, and I'm not sure if this is the company that it is, but it's like these drops that supposedly, I'm saying supposedly because obviously they don't, are supposed to lighten your eyes. So just please be very careful about what you're putting in your eyes. Your eyes are like such a vital important to you, but they're also very like delicate. So you don't want to permanently damage your eyes. Most recently, FDA warned customers about a long list of eye care products sold at major retailers, including CVS, Rite Aid, Target, and Walmart. Manufacturer Killage Healthcare India subsequently announced a recall of those products. So I would avoid any generic over the counter eye drops from CVS, Rite Aid, Target, and Walmart at this time. I use this for my severe dry eyes. You probably can't see it. It's Theratears. And let me see who. So this is made by uh MedTech. So that's not on one of those lists. FDA also sent a warning letter to Amazon over 7 eye care products sold on its website, charging that the products are unapproved new drugs as they make claims about treating disease. Problems with eye drops were first identified in May 2022 in Los Angeles County in California. And before the end of the summer that year, a total of 4 cases of eye infections with Pseudomonas had been identified in California, and similar cases started popping up across the country. Ultimately, the bacteria were genetically linked. Courtney Hauser, an ophthalmologist at Duke Health in Durham, North Carolina. She's saying she's staying up to date on the FDA alerts and assuring patients that there are still trustworthy eye drops on the market, such as from major brands Bausch and Lomb, Allergan, and Alcon. She has told patients to avoid any generic eye drops while the recalls are going. And yes, that's what I'm telling you today. Avoid any generic eye drops until further notice. We get a lot of questions from patients. Hauser told MedPage Today, patients are scared as they should be. I think it's scary as an ophthalmologist as well, because this isn't something that we expected to encounter or have encountered before. Uh, Dr. Kevin Miller, an ophthalmologist at the University of California, acknowledged that this string of recalls is unprecedented, but said he also believes there is a danger in scaring people away from using needed medications. So this has not impacted as of yet. For example, I use the medication Restasis for my Sjogren's, and they have not been impacted. I don't think we should stop treating dry eye or stop treating glaucoma because there's a few bad products on the market. We've had worse problems if people stop using glaucoma drops because they're concerned about the potential rare possibility that they would have contaminated drops handed to them. So just continue to check the manufacturer of who makes your eye drops and make sure it's not on the list of companies where they found contamination. E-commerce providers need to stop allowing third-party sellers to sell over-the-counter drugs that are not registered with the FDA. That will keep out a lot of risky things from the market, Petra said. And manufacturers need to let people know where their products are made so consumers have a choice. Petras noted that Ezra Care had more than 2,000 reviews and 4.5 stars on Amazon before the outbreak appeared. It is nearly impossible for consumers to identify safe eye drop products online. While the FDA can do more to address issues with online retailers, Brown explained that more work should be done in Congress as well, including increases FDA's funding for overseas inspections and passing laws to improve packaging labels on over-the-counter eye products. So again, a lot of these eye drops that were recalled, they were made by a company in India. So there's not as much regulation over there as there is in the US. So when you buy eye drops, you want to make sure that you're buying eye drops that have been made in the USA, packaged, et cetera, packaged in sterile labs in the not sterile because, well, these eye drops are sterile. Um, but just that they're following FDA protocols for keeping everyone safe that's consuming their products or using their products. Petrus also warned of the potential for products that are currently still available to be recalled in the near future. This is a time for great caution about over the counter eye drops, particularly those sold online. Petrus said, we're expecting more as they keep inspecting more factories, more stuff is going to come to light. So let me know your thoughts in the comments. Like I said, I use eye drops all the time. So this is scary about, and of course, if you, hi, Mr. Midwife, miss you. Mr. Midwife, can you let me know when you are available on Fridays? Because I'm changing. I will not be going live every Friday from now on. I plan on alternating Fridays, like every first or fourth or every, you know, so yeah. But anyways, what are your thoughts on this recall? Of course, if you have symptoms of a bacterial infection in your eye, conjunctivitis, there's different types of conjunctivitis. There can be bacterial, viral, but if you chemical also, if you have like goopy discharge, your eye is red, please go see a doctor, period. Like it could be an optometrist, you could go see an ophthalmologist. And if you can't even get into them, you can go to your primary care physician, your primary care provider. You could always go to urgent care, but do not play with your eyes. If you believe you have an infection, please go get it taken care of. Sooner the better. There are antibacterial drops. The issue with these is that I believe this was a particularly stubborn like resistant strain to antibiotics. And that is, yes, Mr. Midwife says, see somebody. And that is the concern, the issue that is arising, that we are heading into with this antibiotic resistance. A lot of these bacterias they're evolving and they're becoming resistant to antibiotics. So when at all possible, make sure that you are, if you're a healthcare provider, prescribing antibiotics responsibly, and if you're a patient, making sure you don't take an antibiotic when you don't need one. If your healthcare provider does not believe you need an antibiotic, please be kind and don't uh, curse them out because you want an antibiotic. It has happened. Um, for example, like overprescribing of antibiotics is egregious sometimes because providers feel like if they don't want that fight, they don't want that dilemma of or they don't have the energy to deal with the patient that they're insistent on getting an antibiotic and they don't want to get into that fight. Now, and then the people that don't prescribe the antibiotic, then they look like the bad provider because they're telling you this is viral, you don't need an antibiotic, and then the patient is upset. So just be responsible with your antibiotic use because we are seeing a lot of resistance when it comes to antibiotics, unfortunately. Thank you so much for watching. That's all that I had today. FDA is you can always, I think I linked the article in here, but just be very careful about over-the-counter eye drops. There were 14 who suffered vision loss, 4 who required removal of an eye, and 4 deaths. Exactly, Mr. Midwife. If it's viral, antibiotics will not help. And then what happens is the people that don't prescribe, for example, it would happen with me all the time. I'm trying to go buy the book. If it's viral, it's viral. You don't need an antibiotic. And then they go see a different provider that does give them a Z pack when they don't need it. And they're happier with the other provider because they got the Z pack, even though you would have got over that cold, that virus without an antibiotic. So if it's viral, antibiotics will not help. There's also viral sinus infection. So if you're on day 1 of like facial pressure, give it some more time. Don't run to your primary care provider for sore throat on day 1. And if you're having a sore throat and cough on day 1, give it some time, see if your body works through it. Strep is a little bit different. You do want to catch that early. If you're not coughing, and you have a very sore throat, you enlarged tonsils, that's completely different. You wouldn't need an antibiotic, but most issues in adults, strep is rare in adults. It's younger, it's more prevalent in adolescents or children. So yeah, but that's my that's my soapbox for the day. Make sure you like, subscribe. Let me know also what day works better for you, which Fridays out of the month. Because, like I said, I will not be going live every Friday anymore because I feel like I never have enough time in my life. Anyways, bye.